Hello. In this section we'll look at the edge clearance of a corneal GP lens and how it differs from edge lift of a corneal GP lens. So edge clearance is the amount of space between the edge of the lens and the front of the cornea. It's the clearance between the two surfaces. The edge lift is a geometrical measurement that relates specifically to the curves on the contact lens itself. But the two terms are often confused and edge lift is used as a general term. But to be accurate, when we're looking and describing a corneal GP lens fit, we need to discuss and talk about edge clearance. So let's think about why we need to have edge clearance. Edge clearance is important for a couple of reasons. One is to allow tear exchange underneath the lens. This tear exchange removes any debris under the lens and reoxygenates the corneal tissue with fresh tears. The other reason that we have edge lift is to allow the lens to be removed. If there wasn't edge clearance, the lids would not be able to get beyond the edge of the lens to help the patient remove the lens from the front of the cornea. A reduced edge clearance lens can in some instances become bound to the cornea, which is very unsafe. So edge clearance is really important and we need to have an accurate method of measuring that edge clearance. This video shows a corneal GP lens online with excessive edge clearance. On the next slide, we'll discuss the reasons as to why this is not suitable to leave this lens on this patient's eye as it is. So if we think about this video that we've just watched and look at the excessive amount of edge clearance that was on that lens, let's think about some of the reasons as to why we would not want to leave that as it is. So excessive edge clearance can cause patient discomfort. If you think that the amount of space between the cornea and the lens is increased, it's much more likely that the lids will cross that edge of the lens and be uncomfortable for the patient. This can also alter how the lens performs. So the lens can then start to move excessively. It may become attached under the eyelid, and we have a lid attached design. This can cause corneal trauma, discomfort, excessive movement, which can really lead to our patient becoming non-tolerant to the corneal GPs that we're fitting. In some extreme cases, if we have excessive edge clearance, the lens may not center accurately. The lens may even fall out if the lift on the lens is too great. And the action of the lids closing can sometimes cause the lens to fall out completely. Now, some system designs will have a reduced edge lift option, but not all of them. So it's important to check and understand the lens that you're using and fit into the patient. If you do see that it has excessive edge clearance, check with the fitting guy to see if a reduced edge lift option is available. If it's not, then it may be that we need to refit the patient into another lens, or possibly design a lens from scratch as a multi-curve with a reduced edge lift option. If, however, the lens is also flat-fitting and has excessive edge clearance, then sleeping in the BOZR may help us to reduce that excessive edge clearance. So let's now think about minimal edge clearance. So watch this video and then we'll discuss the issues around minimal edge clearance on the next slide. So a reduced or narrow edge clearance will, oddly enough, be very comfortable for the patient. It will reduce the lid sensation of the lens as they blink. However, there are several issues around a reduced edge clearance. In some cases, a reduced edge clearance, because it doesn't allow for adequate tear exchange, can cause the lens to become immobile and may even bind to the cornea. If we have a lens that's bound to the cornea, it's highly likely it will indent into the cornea, and on removal, It may even take the surface layer of epithelium with it, which is extremely uncomfortable for the patient and damaging in the long term. A bound lens can damage the cornea in other ways. Because there are no tears being exchanged, the cornea itself is not being reoxygenated with fresh tears. So this can lead to corneal exhaustion syndrome, where the cornea itself loses its oxygenation. On patients such as these, you'll see corneal edema, central corneal haze, reduction in VA, and in extreme cases we may even see folds or striae. So the lift of the lens must be increased by altering the lift if it's an option available on the lens that you're fitting. Or if the lens is also steep as well as reduced edge clearance, then flattening the back optic zone radius can help to increase the lift away from the cornea. Thank you for your attention. Please click on the link for the next slide.